Hi, I'm Dr. Christina O'Flaherty. I'm a clinical psychologist in private practice, and I'm doing a short video clip to talk to you about what to expect in a first psychotherapy session. So the reason that I'm doing this video is that even for the bravest of souls, it can be a really tough thing to go in and talk to a complete stranger about whatever it is you've been struggling with. And so if you're out there and you're watching this and you've been thinking about talking to a therapist but aren't quite sure how it's going to go or what that first session will be like, I hope that this will be the thing that helps you reach out and get some help with whatever you're struggling with. So first sessions are generally longer than regular therapy sessions. They're about an hour, which gives us a good amount of time to get to know each other. And that's really the most important thing to do in a first session, is for me to get an idea of who you are and what you've been struggling with and how that problem has affected all the aspects of your life, how it's affected your relationships, how it's affected your mood, your work, and really kind of get an idea of how I might be able to work with you to help you. And it's also a great chance for you to get to know me and to see what it would be like to have me as your therapist, to see if it feels like I get it, like we're connecting, like I'm really listening, I'm not judging you, and for you to kind of see if you feel like this is something that could work for you. And so the first question that I'll ask you when you come in is, what's brought you in? What's been going on that you've come to see a therapist at this point? And then it can kind of go two ways. There are people who have been thinking about coming to see a therapist for a really long time, and they know exactly what they want to say, and they have no trouble kind of letting it tumble out and really fleshing out what the problem has been and how it's affected them. And in that case, then I kind of sit back and listen and reflect on how I might be able to help you, how therapy could help you. And then there are also people who are having a harder time getting the wheels turning, and they might not be able to let things kind of spill out. And in that case, I'm taking a more active role, and I'm asking a lot of questions to engage the person to be able to talk more about what's been going on for them and how it's affected them. Either way, my goal of the first session and all sessions really is to get people curious about what's been going on, to get them to be really interested in understanding what their experience is and how it's affected them. And so we're trying to cultivate some curiosity in that first session, and that usually leads us to having, even in the first session, having a different way of looking at what you've been struggling with, a way of reframing the problem that you're bringing in, or a new narrative to put to it, or at least a more in-depth narrative to put to it. And then sort of towards the end of the session, I will be giving you concrete feedback about how I see your problem, how I think therapy might help you, how I work with patients, and what my style is, and how long you can expect to be in therapy, that kind of thing. And then it's your turn to ask any questions you might have of me. And then at the very end, I'll ask you how you thought it went during our session, whether or not you felt comfortable, and whether or not you feel like it's something you'd like to continue. And if you would, then we make more sessions and we commit to working together on what it is that you've been struggling with. So if you're out there and you're watching this and you've been thinking about getting some help, I hope you'll take the plunge, reach out, and make that first appointment.